went to see a eating disorder specialist, a therapist, and talked to them about my eating disorder. And they recommended I go into inpatient treatment. So inpatient treatment is where you go live in a hospital. And she told me that she recommended this level of care because of the severity and the duration of my eating disorder. Inpatient treatment is necessary a lot of times because the refeeding process for eating disorders, it can actually be very physically dangerous to just start eating a normal amount of food again. So I went to live inpatient in a hospital for a month to do that refeeding process safely. And there I was given 3 meals and 3 snacks a day. Part of me still just wanted to keep doing the eating disorder. And I remember telling myself, even when I was in inpatient, that I was just going to go back to the eating disorder after I got out again. Initially, it is very difficult to start eating again. Luckily, the staff there was understanding, and it just helped a lot to have support going through that time because it is a very physically uncomfortable time and also a very mentally and emotionally difficult time. But eating disorders are a very severe issue, so it really is what I needed. We would also have meetings multiple times a week with a dietitian, and the dietitian would help you figure out a meal plan for you. And that was very helpful because they were able to teach me how to actually eat healthily. Because I had had the eating disorder for so long, I didn't actually even know what a healthy relationship with food looked like. So in treatment, I learned what is actually an appropriate amount of food and how to actually eat healthily. You can't really benefit too much from therapy in the very initial stages of recovery because your brain is so malnourished. I just had to eat normally for a while to be able to even process and get the benefit from therapy. So really just normalizing the eating is key early on. The main priority was just to get physically stable and to start eating more healthily. I met with an individual therapist multiple times per week, and we did a lot of group therapy, and yoga, and just a lot of healing sort of therapy. Dissociation can be a big contributing factor to having an eating disorder, because when you're dissociated from your body, you can often be disconnected from hunger and fullness cues, and it can make it so you don't have an appetite, and it's just a lot harder to eat sometimes if you're dissociated. So learning grounding skills really helped a lot, and processing the trauma so that my dissociation lessened was extremely helpful for being able to get reconnected to my body and to learn how to feel an appetite and to want to eat again. Part of recovering from eating disorders is learning healthier ways to cope with stress and trauma. I also learned a lot more healthy coping mechanisms and ways of dealing with my emotions in a healthy way that didn't involve maladaptive coping skills, like the eating disorder or self-harm. One of the most important things I learned in eating disorder treatment was the concept of self-care. I had never really been taught self-care, what self-care was, or how to do it, so I hadn't learned how to internalize that and care for myself. In the eating disorder treatment, I found learning the concept of self-care was very helpful. I was then able to practice doing self-care. I learned what that looked like and how to do it for myself, and this helped me directly combat the eating disorder behaviors. I did inpatient treatment for a month, and by the time that month was up, and my cognition was starting to come back a little bit, and I was getting physically healthier, I actually started wanting to recover more. I'd gone in truly feeling I was just doing this for other people and truly feeling I didn't want to recover. And by the time I got out of that month of inpatient, I actually did have a glimmer of hope, and I actually felt more like I wanted to do it for me. So this is definitely possible. After I finished inpatient treatment, I went into partial hospitalization. So this is 5 to 7 days a week, 8 hours a day, about. It's pretty much a full-time job. And again, I did a bunch of groups, a bunch of individual therapy sessions, yoga, eating 3 meals and 3 snacks a day. And this is where I started getting more into actual trauma processing. We started working on some of the underlying issues of why I had developed the eating disorder in the first place. And I found this just so extremely helpful. I feel really lucky because I was able to do therapy for like 40 hours a week every week, and it allowed me to make a lot of progress really quickly. I started actually figuring out what was beneath the eating disorder, and then because I was able to process those underlying emotions, the need for the eating disorder actually lessened. I did partial hospitalization, and then I did intensive outpatient hospitalization, which is basically the same thing, but just less days per week. This allows you to start having a little more time outside of therapy to practice doing healthy coping skills in your life away from the hospital and the treatment setting. Even though I had started having more motivation to recover on my own and I'd started really good therapy, it took me a couple rounds of treatment. My first time I did inpatient and then partial hospitalization and then outpatient. And then I was away from therapy for a few months, and then I ended up going back again. I relapsed a little bit with the eating disorder, and I went back into partial hospitalization treatment, and following that I did intensive outpatient treatment again. This just goes to show that eating disorders, they do get very ingrained as a behavior, and they can be very difficult to recover from, even when you do want to recover. So be patient with yourself if recovery is taking a while. One of my favorite sayings I learned in treatment is progress, not perfection. You don't have to recover quickly as long as you're always making progress. It can take a while, and you don't have to be perfect, just as long as you're trying. So I went back to another treatment center and did another round of PHP and IOP. And then after this, I still was struggling. I still hadn't fully recovered from the eating disorder. And so thankfully at this point, instead of just giving up, I kept going. My treatment providers recommended I do residential treatment. So residential treatment is similar to inpatient in that you go live in the treatment facility. But residential is held at a house instead of at a hospital. So I went to a house with 5 other patients, and the 6 of us lived there, and I stayed there for 2 months. And this is really what I feel allowed me to fully recover. It can actually honestly really help being locked in somewhere and having staff around 24/7 to help you out, because I had to just full-time practice and enact recovery. When I was in residential, I began with a meal plan, and then in my second month of being in residential, we switched from working off of a meal plan to practicing intuitive eating. And intuitive eating is where you are taking cues from your hunger and fullness signals. So this was really good for me because this allowed me to get more in touch with my body and how to actually eat intuitively in a healthy way. A lot of eating disorder recovery is fake it till you make it, or fake it till you become it. So even though I was still struggling with eating disorder behaviors and eating disorder impulses in this residential setting, I just 24/7 faked it. I ate all my meals, I did all of the healthy behaviors, and after 2 months of faking it, I made it. I was able to leave residential treatment and actually stay in recovery. I didn't relapse again at that point. I was able to say after that that I was basically recovered, and I'm happy to say now that I've been recovered for 5 years, which is just amazing to me. I never thought in the past that I would be able to say that. And life is so much better when you don't have an eating disorder. So recovery is really worth striving for. So I just wanted to make this video to stress that however long you've had an eating disorder and however severe it has been, recovery is possible. It takes a while to develop an eating disorder, so it also takes a while to develop the skills to recover from one. And there is a lot that is underlying eating disorders. It's very much not about vanity or weight. Weight really doesn't matter at all in regards to eating disorders. It's a lot more about just being a maladaptive coping skill for stress and trauma. So I just really want to emphasize that recovery is possible. Even if recovery is taking a while, even if you have to maybe do multiple rounds of treatment, don't give up hope, because it's worth it to keep at it. If anybody has any questions for me about eating disorders or recovery, feel free to ask them in the comments. And if anybody who has gone through eating disorder recovery would like to share their experience in the comments, that would be really great.